Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of Geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning. I'm glad you came because I've had a couple of friends, women, their husbands have passed away over the last week, as a matter of fact. And, it's very sad because these women are probably in their 50s. I don't even know if they're in their 60s. But the one thing that has really helped them has been hospice. And one person, it's interesting, one person, the family of her husband, did not want them to call in hospice because they felt it was a death knell. And I said, no, on the other hand, it's going to help him and you.
Absolutely, yes. I had the pleasure of having Dr. Kennedy visit me by the office. And we were talking exactly about this topic, the taking care of the patient toward the end stage of life. And, people need to understand that dying is part of living. People see dying as a negative thing, and
dying is part of living.
It's part of living. It just like you birth and growth and development, and then you die. So it's part of the life cycle, and we have to embrace it in a way that it doesn't have to be a negative thing. We want to gather all your loved one around you if possible. We do, one of the things that we always want to do with dying is we don't want to play God. Mm-hmm. And sometimes when I have a patient of mine that is dying, the kids will call and say, oh, I hadn't seen my mother for 20 years. Could you hold, I said, no, I'm not God. Keep her alive until I get there. I say, no, I am not God. I will do, it's on God's hand now. It's not, my job is to keep her comfortable, not to keep her alive.
We're working for the past 20 years.
Exactly. So that, this patient, they come in with certain end-stage disease. And it doesn't have to be cancer. That's another myth. A lot of people think, you go into hospice because you have terminal cancer. You can go into hospice because you have end-stage Alzheimer's disease or end-stage congestive heart failure or end-stage emphysema, where, your quality of life is just decreasing so much that you want to go from a maintenance mood to a comfort mood. Just keep me comfortable. And what that means is that we can use other types of medication that we normally would not use in a regular patient for the sake of comfort of that patient. So to give you an example, we usually use the medication atropine on patients when we're going to work on their eyes, but sometimes a patient might have so much secretion in their lungs that they are drowning in their secretions, and we might use atropine to dry their lungs so that the lungs now being dry lungs will help us give better comfort to that patient. So other patients, they have other conditions or multiple conditions, but what counts is their quality of life. They have such a poor quality of life that they don't want to live this way with discomfort. And they will, we will then call one of the hospice company to come in and to do an assessment. And, it's beautiful because when hospice come, it's like a home health care agency. They bring a whole team with them. Home health, they bring you the physical therapy to the house, occupational therapy. Hospice is even bigger than that. They'll bring you either the rabbi or the priest, the social worker, all your medication all at home. They bring you kits of medication that come to the house. The nurses will be coming frequently. So the support system is amazing. And
They
then
have music, because I remember on my show once, Dr. Mencia, they actually had a music therapist, and he came and he sang, and they do that. But the other thing is that I think I've relayed this to you before, that there was a hospice up in some of the hospice, of course, they take care of you in your home or they take care of you in the hospital, but there is a place, sometimes they have big hospice hospitals, like they have one in Boca, and then they had one in West Palm Beach. And the man requested, they say, what would you like? And he requested to see his horse before he died. Nothing would do, but they brought the horse to hospice. They had the horse come into his room. That says it all to me, doesn't it?
Exactly. And it's all about that. I remember my father-in-law, he has end-stage colon cancer. And one of the requests that he had is, I don't want to die in a hospital. And he was really sick. And I said, let me bring you home. I bring you to my house. But the only rule, I don't smoke in my house. So, you can stay with me. And I remember that he used to go to the backyard and light up a cigarette. And the day before he died, he called me and he said, Andy, I need a cigarette, but I don't have the strength to go outside. Could you light up one for me? And I took a cigarette, lit it off for him. I took a few puffs and put it in his mouth. He took 2 puffs of the cigarette. And he said, okay, that's enough. That's all I wanted. So we turned it off. He went to sleep. And the next day, he went to heaven in the morning. So, it's being there for the patient and make sure that they are comfortable. They are, bring comfort to the patient and the family.
In your practice, though, have you seen people, because I keep saying it doesn't mean that you're going to die, that sometimes you can even get better and leave hospice. Have you in your practice seen that happen?
Numerous times. And I use that when I talk about polypharmacy. Sometimes we over-medicate patients. Patient will go to, and that's why I love the center. The way I created a center, the objective is to integrate a better care for the patient so that we don't need to take 4 blood pressure medication if we have one that will do the trick. We don't have to take 4 different diabetic medication or even injectable. If there are pills out there that are strong enough, good enough to get the job done. So in polypharmacy, a lot of those individuals that are going to hospice, I use polypharmacy, hospice as an example in polypharmacy, because you get those patients off from most of the medication that they are taking, and suddenly they start waking up. They are feeling better. The family come questioning, like, do we really need to be into hospice? My loved one now looks so much better. They say, it looks much better because we took all those chemicals out of the system. And then the real baseline will show up. And then we can make a decision. But I have seen many patients that go into hospice. Hospice is not a death sentence. That's one of the myths. People think if I'm going to hospice, they're just going to kill me as soon as possible. It's not a death sentence. A lot of people will go into hospice with certain conditions. It's not like a end-stage cancer disease that we know that death is imminent. Sometimes it's not so black and white. It could be a patient with emphysema, advanced emphysema, and they go into hospice and they still having their oxygen, they still taking the medication so they can breathe better. And they live long enough that hospice say, it's been 8 months and your loved one is doing fine, so we're going to sign off and we're just going to let your primary care doctor continue to care for them.
That's great news. I'm glad that you shared this, because this will alleviate, I think, a lot of people who really saw it as a death sentence.
And, that's one of the reasons that I felt that home visit was such a great thing for us to do. Because what is hospice doing to those patients? They're basically providing a lot of care at home that otherwise you will not get. So when we do go to the home, we bring the lab, the ultrasound, the physician, the nurse practitioner, the home healthcare agency, we create that team. We bring that team together to try to provide the same type of care to the patient at home as we would provide at the office. As we want to mimic the office as much as possible at home, without converting your home into a hospital. Because that's the idea. The idea is that you don't want your home to be a hospital. You want your home to be a home.
Yeah, and I'm so happy that you just mentioned that again. We can't stop mentioning home visit services are available for homebound patients. The phone number to call the commercial office, it's 954-489-1345, 954-489-1345. And, of course, this is Dr. Andy Mencia, who is the wonderful world of wellness and all his analogies and everything he does. It's so great. And yesterday you called me. I'm just getting off the hospital for 1 second. You called me for a facial. I'm in the middle of meetings. I would have loved to take my helicopter and fly there. Why were you doing that now? If I thought facials. You were doing the facials, I would have been there no matter what.
No, I have a esthetician that started working with me yesterday. And she was treating the staff. So I told Claudia, I said, I want Anita to get a facial. I would love Anita to
get So do I get this another time? Oh,
so
she's there now all the time?
She will be there some days out of the week.
Really?
And yeah, it's a great treatment.
So I have to make an appointment.
Yeah, as a matter of fact, her very first patient was this patient that came to see me. And she come from Miami to see me. She, her husband had to drive her all the way down to my office because she refused to see anybody else.
Smart girl.
And they relocated, so he will, on his day off, he's 70-something, he still works and everything. On his day off, he will bring his wife over. And she was feeling down, but not to the point that we need antidepressant. I said, I'm going to treat you to a facial. So she was the very first person we treated.
She loved it too.
Oh,
didn't
she was taken by it. Like, I don't know. She was getting so nervous. Are you sure? I said, yeah, go make yourself beautiful. Go and get a facial. Go and take your husband out afterward.
So is that the secret of your success? Whether you have this gorgeous face, so you always get facials?
No,
that's a natural Hawaiian face.
That's
right?
me. That's my Hawaiian look.
That's the coconut oil.
She offered me one, but I was going to a business meeting. So I told Sylvia, no, another day.
But you're right. I do
get facial when I have the time. Absolutely.
Yeah, I get facials. I get massage because it does.
I love the deep tissue massage.
It's what I get. I get that every 3 weeks. It's one of my. I actually clean my own home to use the money to be able to have the massage because I think it's so important. And people. And do you now at your?
I do my own laundry.
You see, I do my own laundry, so then you don't have missing socks.
Yeah, there you go.
But let's get back to the hospice because it's really an important subject. So my friend who was really having terrible time because here her husband is in very bad shape. He's had cancer and they've done so much. And then the parents of her husband are very upset with her because she wants to put him in hospice. And I said, look, he's your husband. You do it. And
Absolutely.
It's the best thing. And after she did it, they apologized and they said it was better because here he was screaming, he was in pain.
Usually the other family members, they go by the myth and not by the fact. And, you, the one that is close to the individual that needs hospice, you have to make that call. It's not a family decision. It's a personal decision. It's between you and your loved one. So if your loved one, if they will tell you, Anita, if I'm at this situation, at this stage, I don't want to be intubated. I don't want to be running from emergency room to emergency room. I want to die at home. I don't want people pumping on my chest because my heart stopped. It's between you and him. So you might have family member, and this is very important. So, that guilty conscience when a person say, oh, I have not seen my mother for 20 years, so hold everything. No, that's not my problem. My problem is to take care of that patient here and now. So, it's not a family decision. Sometimes it's a personal decision. It's between that patient and their loved one. So it's between your friend and her husband. And if her husband don't want to, to be poked and intubated and put a Foley catheter every time you go to an emergency room and be put on diaper and, make that decision and make it early. And a lot of times I tell my patients, when I see the hospice is in the near future, I will sit down with my patient. I say, I want to call hospice. And I say, am I that bad? I say, no, you're still good. And that's why I think hospice should meet you now. Because I like my hospice patient to meet us the way you and I are now, sitting and standing and talking and smiling and joking. So they get to see, who's Dr. Mencia? Who's Anita Finley? We are who we are now, not when we are in bed almost dying.
That's great, Dr. Mencia.
So sometimes I like my patient to have that meeting as early as possible. And we don't have to make that final decision there, but there is already that connection is there.
And they will come even if it's
they will come even.
Is that right?
Not only they will come and they will make unpaid frequent visit to see how things coming along, or they will make unpaid phone call to say how things are going, is everything okay? They keep that contact going.
That's amazing. I did not know that. And when they always say, someone said, well, if you're in hospice, they expect you to die within 6 months. Is there a rule?
There is no rules. There is no time limit. Once you are in hospice, it's like Dr. Kennedy and I were talking, and some of the people feel, if you put me in hospice, you're going to kill me in 2 or 3 days. He say, it doesn't pay for me to kill you in 2 or 3 days.
That's funny.
The longer you live, the better
it is for us. Yeah. Exactly. Oh, that's very funny. You're going to kill me.
So, they are not there to a good hospice company. No, all are the same. No, all hospice are the same.
We will have to have her back another time, but Karen Kennedy is Vice President of Medical Affairs at the Trust Bridge Health, which she's Associate Medical Director, and now she serves as Vice President of Medical Affairs. So she has a strong history with Trust Bridge, and is that part of the hospice?
That's one of the hospice that I work with, and have some experience with them. And before it used to be called Hospice of Broward, so it's a few
that's
company.
Right. So I see. So it's I didn't know because they did the same thing in Palm Beach County. They had some and they merged.
As a matter of fact, when my mother-in-law was terminal, they came and took care of my mother-in-law at the home, and they did such a great service.
What did they do?
They came and they made sure that she was comfortable, that her medication were there all the time. That the kids and the grandkids were aware of what's going on. And then the important things of hospice, because sometimes you are with your primary care physician, and when you die, that's it. If you don't have anybody else coming to that doctor, the relationship ended. With hospice. Hospice, they still contact you. How are you doing? How are things going? Is anything
afterwards?
Afterwards.
Because we know that there are support groups in grieving.
Grieving, so they support you through the grieving period. You and the family around the loved ones. So that's very important. So you can bring closure to the situation.
Yeah, see, a lot of people are not aware of what really happens there. There's just fear, as you said, but doctors are important in this, and I have to say that and we know, and this is like a financial discussion in a sense that when doctors give up a patient to hospice, then they no longer get the Medicare.
In the case. Absolutely.
Yeah, and that's one of the problems, and that's not right.
And that one of the things that I do.
So special.
I always stay with my cases, and all the hospice companies that do work with me, they say, "Oh no, Dr. Mencia, don't sign him off. He'll get upset." Because most of the hospice, they think, well, since most doctors sign off the moment hospice step in, you don't have to do that. As long as, you are treating the patient for everything else, that it is not the condition that they went into hospice for. So let's say a patient with end-stage emphysema going to hospice. Hospice is responsible for the end-stage emphysema and the comfort care of that condition. I am responsible for the constipation, for the arthritis, for the back pain, for the migraine,
Really?
for the,
It's fabulous.
whatever else is going on with that patient, we are still responsible. So, instead of giving all of that to hospice, I say, no, and it's my patient. Why would I, if I'm a true believer that dying is part of the cycles of life, so why give that up? Be there with your patient.
You are you just every time you're on the radio, I just get to admire you more and more, respect you more and more, because you truly are a man of medicine. You believe, you took that oath, and you really believe it, don't you?
I do believe it, and I think we need to socialize it more. We need to humanize it more. Medicine is not just the chemical part; it's the psychological component of medicine, the economical component of medicine, and then the biological. So if we don't think on those three spheres, we're always going to be missing two of them at least. So it's important, you you give a medication to a patient, and your job is to write the script and put refills and tell them, see you if you need me. But that's not so true. It's so much stuff. I had one of the pharmaceutical rep that came by me the other day, and she was telling me, do you know, Dr. Mencia, that my company, if the patient gets into the donut hole, you don't have to change the medication. Our company will go ahead and supply the medication for the patient while they are in the donut hole.
Really?
And I said, wow, I didn't know that.
No one knew that.
And I said, I didn't know that. And these are information that, I'm always talking to my pharmaceutical representative and learning from them, from the social point of view, what is there available for the patient. And a lot of times, when the patient comes in and says, oh, I'm running out of X medication for my blood pressure, I will call the rep and say, bring me a month sample supply. I need it for my patients so that they don't have to.
Amazing. So that's what
they
you're
don't have
talking
to switch medication. But now I know, there are certain companies that will even go ahead and,
supply the medicine until the donut hole is
absolutely. And for any medication that you take that works well for you, what you need to do is go into the website for that pharmaceutical company, and there is most of them has a link to patient assistance program. And you link into that, and some people are sort of ashamed to say, oh, I need financial assistance. It's your health. There's no shame here. And, they are doing that. They are not throwing money away. They are doing that because, it will be a tax deductible for them. So, they are not losing money. You are not losing anything. You are keeping your own medication. So it's important to look into those things. And
very important. I'm so glad you mentioned that. Let me give a phone number again to make an appointment. A few things. If you want to make an appointment to go to Commercial Boulevard's office of the AGI Medical and Dental Centers, you would call 954-489-1345. If you want to go over to the Boynton Beach office, it's 561-270-6494. Dr. Mencia, if they're not open on a particular Saturday, if they call the other number commercial, then they
can call the number all the
time.
time. All the time.
So
that's the main hub. So,
okay.
Yeah, we are always there.
They'll help you. And so,
as a matter of fact, the Sunday just passed, we have a patient that called with a dental emergency. It was Sunday. I was going to go on a cruise. So.
You didn't?
Yes, I did. Call one of my dentists. Are you available? Can you come in, please? Let's see if we can see this patient. And
you're beautiful.
Yeah, we took care of the patient.
Yeah, see, that's why you brought in a dental division, because it isn't just, for medical is medical, but dental is medical also, even though
it's part of healthcare. Yeah, it's part of the body. Having the podiatrist for you, the neurologist, the eye doctor, the dermatologist, The sonographers now come in on Saturday for those patients that cannot come on the weekdays. And it's not that they cannot come because they cannot get it right. Sometimes it's just financial reason. They need to work Monday through Friday. So if they need their blood test done, or if they need their echocardiogram done, or check the veins in the leg, then I'd rather do it on a Saturday because, it's hard for me on the weekdays because they need to work.
Sure. So they're open usually till about noon. And so make your appointment if you can. If you have an emergency, just go in. But it is amazing how Dr. Mencia's staff, they're just so lovely. They're so caring. One thing we haven't talked about, maybe we have to have one of your nutritionists back on because it's so unusual for a doctor to have a nutritionist on
and I
staff.
have two of them.
Two beautiful women.
Two beautiful ladies
who are just
that
amazing.
They are amazing. They are so knowledgeable. And, I'm so happy because we were talking about some doctor having the belief that osteoporosis is not a disease. It's something that you're going to get as you age. It's part of getting old. There are people that we have so many people with obesity that don't want to be obese because, that's one of the problems. People think, they are obese because they are lazy. It's the gene. They have the gene and people will gain weight very easily. And we have a program for obesity to help you reduce weight that is covered. Whatever is covered by insurance, we do it. We don't charge anybody extra to come into a weight loss program with us.
And we are going to have one of your nutritionists back maybe on the next show or something. But thank you, Dr. Mencia, as always.
Thank you, Anita.
You're so inspirational. Thank you for being here and have a great weekend.
That you too.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.